Hi everybody, I'm here to talk about using ginseng in the treatment of chronic Lyme disease with Chinese herbal medicine. So we look at Lyme disease from a perspective of what in Chinese medicine is called Gu syndrome. This is an old way of treating chronic latent parasitic infections, chronic infections of many kinds, especially parasites. So classically, the use of ginseng in the treatment of Gu disease is forbidden, and that's because it's said to tonify the pathogen. It's something that feeds worms directly. It's something that makes the latent pathogens hiding in the human body stronger. And because Lyme, Borrelia, and all the co-infections that come with it tend to act very much in the same way as a parasite, we avoid the use of ginseng when we're treating that. However, some new research has come to light which has put that in an interesting context, and having experimented with this a little bit from a Chinese medicine perspective as well, I think it's worth revisiting that old tenet of Gu syndrome. So the research I'm talking about in particular used ginseng over the course of a couple of studies treating a Pseudomonas infection in lungs. And Pseudomonas is something that is rather difficult to treat. It's bacterial in nature. I believe in these studies it was being combined with antibiotics or perhaps used on its own and studied the effects of them so that it could be used concurrently with antibiotics. Researchers noticed that the ginseng itself did not have an antimicrobial effect, which they didn't expect it to. And speaking as a practitioner of Chinese herbal medicine, we wouldn't expect the ginseng to have an antimicrobial effect either. It's never been used for that. But they did notice two interesting phenomena. One, it increased biofilm production of the Pseudomonas. So biofilms, if you're not familiar with that term, in Chinese medicine, we often attribute it to what's considered damp or phlegm. It is literally mucus. It is a thick polysaccharide substance that's secreted by bacteria. It has a number of key effects. It is protective in small amounts of the mucosal membranes of the human body. Biofilm also happens to be a place where bacteria can harbor themselves, can hide from the immune system. They can make it thin or thick, soft or hard, and you find this, literally biofilms is when somebody is coughing mucus, sneezing mucus, dripping mucus from their sinuses. Sometimes we find mucus in stool, and that's often a sign that there is an overgrowth of some kind of pathogenic milieu in that person's digestive system. So the ginseng increased that biofilm growth, and that's something that from a traditional Chinese medicine perspective, we would expect it to do. Ginseng is a very warm herb, and it also it tonifies qi, which is warming. It also tonifies fluid, so it is a moistening herb as well as a tonic to qi. And in the presence of something that is already causing what we consider dampness, like an infection, you wouldn't normally use ginseng. Except if somebody's very weak and they need a little more help, a little more strength to help their immune system fight the infection off on its own. This is the second thing that they discovered in this research, which is that although the ginseng did increase biofilm production, it decreased the ability of the Pseudomonas bacteria to perform what's called quorum sensing. If you're not familiar with this term, quorum sensing is a way that bacteria and other pathogens like to they talk to each other. They communicate about their population levels, about their reproduction rates, about what kind of biofilm they're producing, about what strategies they are using to evade the anti-pathogenic herbs or antibiotics that are being given to the patient, so that or even the activity of that patient's own immune system, so that the bacteria can survive that onslaught. If one bacteria develops a mechanism of antibiotic resistance, some of them are capable of communicating that mechanism to other bacteria. And quorum sensing is largely used to determine population levels, but it seems to be a mechanism by which they can communicate other things as well. So the ginseng inhibited that significantly and made it theoretically more possible or more likely that an antimicrobial agent, such as an antibiotic drug or some antimicrobial herbs, would be able to reduce the bacterial load in the presence of a small amount of ginseng. So let's put this in the context of traditional Chinese medicine and see how that fits. So oftentimes people with chronic infections, specifically Lyme disease is what I'm talking about here, they have a lot of patterns overlapping. Yes, there's the damp, there is the heat, there is the the phlegm, there's the stagnation of qi, and then there's also the vacuities or deficiencies. There's the deficiency of yin, of yang, of blood, of qi, etc. So if you are treating somebody who has a chronic infection like Lyme disease and they are very qi deficient, you might consider using a small amount of Ren Shen, a small amount of ginseng in those formulas. And this is something we see in classical formulas all the time. Something like Xiao Chai Hu Tang is a great example. This is the first three ingredients in that formula are Chai Hu, Huang Qin, and Ban Cha. So you have venting, clearing wind, clearing heat, opening the Shaoyang layer, which is a place pathogens like this like to hide. Huang Qin is, again, very strong in heat clearing, high in berberine content, antimicrobial agent. We know and love this herb very much. And then Ban Cha, Pinellia, this herb is used all the time to dispel damp, to transform phlegm, and can, of course, reduce biofilms. Well, the next herb in the formula is Ren Shen. And so, we trust that the people who wrote these formulas long ago and who have been using them for thousands of years, they know what they're doing in these situations. And oftentimes you find people who have a chronic infection of some kind, they need a little support. So it may be possible to use 3 grams, maybe even 6 grams for short periods of time of Ren Shen in the presence of these other herbs that may help them do their job better. So let's look again at the contextual use or contextual contraindication of ginseng in the treatment of goo disease. So goo, we know, classically referred a lot to worms, a lot to real parasites, helminthic infections. And I was trained this way. I think it is still incorrect to use it when there are worms in play, and oftentimes these are part of the polymicrobial nature of Lyme disease. These patients tend to be hospitable hosts for parasites. A patient a long time ago gave me some expired ginseng powder. It was very, very old. She didn't think she was ever going to use it. She wanted me to dispose of it somehow. So I took it home at the end of the clinic day, poured it on my compost pile at my house. This is the middle of winter. The compost pile is basically dead, just a big heap of rotting vegetable scraps. The next morning, after cooking breakfast, I took the compost bucket out full of kitchen scraps, went to dump it on the compost pile, and expected to just find, again, a big dead heap of rotting waste. When I pulled the lid off the bucket, I was surprised to see that that was not the case. The compost pile was literally covered in worms, swarming with worms, and they were hulking out on the ginseng. So any compost nerd will tell you the worms in your compost, they're doing all the good work there, and what you're really using from the compost when you go to fertilize your garden is actually the worm excretions, the juice, the worm poop. And what the worms are eating in there, it's not your zucchini peels and your banana peels, it's the biofilm that's secreted by the bacterial action that is breaking that stuff down. That's what the worms are eating. So worms love biofilm. And you can even look at this in the context of Chinese herbal medicine when you look at something like dilong, like earthworm. When we use that therapeutically, it's usually in the presence of somebody who has wind, blood stasis, and damp, and that's almost always the presence of biofilm, of some kind of plaque buildup inside their body. So putting the ginseng on the compost pile created more biofilm. We can infer that it did, in fact, it warmed up the heap. It was a cold time of year. It allowed the bacteria to act more excitedly, more readily, and they were secreting more biofilm as a result of this. That increased the ability of the worms to come up in there and eat that stuff up. They were very excited about that, hulking out on the biofilm, as people like to say. So if you know that your patient has Lyme, you're treating somebody with Lyme, it's still good to look at that, I think, in the context of goo. Knowing that this is going to take a long time to treat. There's a lot of layers you need to work through here. Pardon me. And some of those need to be addressed concurrently. However, if you don't suspect that Lyme patient might have a helminthic infection, it may be appropriate to use small amounts of ginseng. So I've tried this out with some of my patients. I know they're free of worms. We've got that out of their system already. they're doing very well on very small amounts of ginseng being included in their formulas, and in some cases recovering faster than I would have otherwise expected. Please play around with this. Use your best judgment and let me know what works and what doesn't for you. All right, thanks a lot.